So thank you so much for that. That's a fantastic question. So before I go to answer that, I just wanted to mention that the Journal of Pediatrics has stated that 1 in 6 toddlers between 19 to 35 months, they start a vaccine series, but they don't complete it. So, for example, they'll start MMR, which is the measles, mumps, and rubella, and they won't finish it off. That means that, and that has been designated as a serious health crisis, because even though that you finish part of it, if you don't finish the whole vaccination series, it becomes sort of null and void, so to speak. So in order to get back to your question, there are 2 kinds of barriers to routine vaccination in children. There's the physical barrier and there is the psychological barrier. So the physical barrier involves sort of access to healthcare. So we're talking about clinics, getting transportation issues that some parents may have, not enough long wait for clinic wait time. A long wait is sitting in the clinic waiting to be seen by the physician, not enough vaccination sometimes in stock if there's a low supply. There's also the cost of running a profitable a clinic and making it viable in low economic areas. There's also a lack of health insurance by the parents. Also, there's a lack sometimes of reminders and scheduling. Especially this happens in a lot of single parent homes where the parent may have multiple children, and they tend to probably forget about appointments due to other issues at hand with other children as well. It could also be parents moving from one location to another and not really having keeping adequate immunization records, not knowing what vaccinations their children have, what else they may need. A lot of the vaccinations for children tend to be age and time specific. So once you can't remember that, it's usually very hard to follow up and know what needs to be done if there's a second shot due or a third shot due. The other barrier that I had mentioned was the psychological barrier. Just a little bit of a history with that. The National Conference of State Legislatures, the NCSL, said recently there's a low vaccination rates among minority children of Black, Hispanic, American Indian children born as recently in 2019 to 2020. A lower rate versus their white counterparts' children. What causes that psychological barrier? There are 2 types of reasons behind that. Vaccination hesitancy and parental vaccination hesitancy. So according to the World Health Organization, vaccination hesitancy is one of the top 10 threats to the public health because it threatens to reverse the progress made in tackling vaccine preventable diseases. So not getting vaccinated, being hesitant about it, as the term refers to, is also a barrier as well. The other one is the parental vaccine hesitancy, which means that most parents, either due to cultural feelings or socioeconomic feelings, feel very nervous about the safety of vaccines, the vaccine side effects, vaccine mistrust, and sometimes there are some misconceptions. A parent will either tell another friend that their baby had a bad reaction to a vaccine, and then the parents listen to that and will not want their child to get vaccinated. So those are some of the structural barriers to receiving vaccination in children. So the main important way that these barriers can be addressed, the main important point is parental education. Just to go again with some research, the CDC has said that primary care physicians, pediatricians are fundamental, and I stress on that word, fundamental in education of parents. Most new parents will listen to their doctor, to their primary care physician. They will go to them and, request information, especially new mothers of firstborn babies. And it is extremely important that physicians and doctors reiterate the importance of vaccination, alienating fears, addressing any concerns that parents may have, doing a lot of follow-up and one-to-one with parents to ensure that they understand the timeliness of getting vaccinated. Again, like I said, some of these vaccines are are very age and time specific in terms of when you get the first vaccine and when you need to come back for a repeat dose. So that's extremely important, and it covers both of the barriers, so to speak. In terms of the physical barrier, where I talked about the clinics and transportation, having more convenient office times for working single parents to be able to make those appointments, to get to the doctor and not take time off from work, especially in areas of low socioeconomic environments where there may only be one parent working, and that is the main caregiver, and in single parent households. So making those appointment times for the clinic very, very accessible to the parent. Offering a lot of social services support, maybe help with transportation. There's something called Access-a-Ride in New York that really helps and is able to alleviate some of the stress of the transportation issue. Clinic having reminders and phone calls reminding parents about their appointments is also something that can help with that as well. And encouraging, I think, primary care physicians that work in areas where there are high incidence of low vaccination rates in order to work in those facilities, giving them extra incentives, probably some more financial incentives in order to work at those hospitals in the lower socioeconomic environments versus the other hospitals that have a high incidence of vaccination rates, making it financially feasible for those doctors to want to work in those lower performing areas. And also doing a lot of community outreach, community involvement in schools, in fairs, in nursing homes, in any areas where the parents will be, where you have an opportunity to do a lot of one-to-one communication and encouraging parents and telling them about the importance of getting vaccinated are some of the reasons that we can come back